was with some friends, and I started to feel really thirsty. And probably every 5 minutes or so, I had to stop to get something to drink. And then as soon as I got something to drink, 2 minutes later, I had to use the bathroom. And it was like that for about 15, 20 minutes until I almost passed out in the middle of the street. Luckily, my mom got me to the hospital because my blood sugar was well over 1,000.
That is very scary. And that was Durrell Becton, who received help from today's guest for his diabetes. It's a chronic condition where the body has high blood sugar due to the pancreas not making enough insulin. So we want to welcome in live now Dr. Stephen Potter, kidney and pancreas transplant surgeon at MedStar Georgetown, to tell us how to handle diabetes if you have it and how to know if you are at risk. Doctor, thank you so much for joining us here on 7 News at noon.
Megan, thanks so much for having me.
Of course, this is so important to spread this awareness. First, doctor, what do people need to know about how diabetes impacts our bodies?
Yeah, diabetes is bad for every part of the body. It really ravages people over the years and has a high likelihood of producing kidney failure. And for Durrell, that was the issue when he came to us on dialysis, needing both a pancreas and a kidney transplant, and he's done absolutely fantastic.
That is, yeah, hearing a bit of his story. Tell us more how you treated Mr. Becton.
Well, when he came to see us, he'd been on dialysis for a long time, and he was suffering the ill effects of both dialysis and the ravages of diabetes. And now he's off dialysis. He's spending time with family. He's had really a fantastic course, like we expect, like most of our patients do. And, you know, here at MedStar Georgetown, we have one of the largest kidney programs in the country. We do over 400 kidney transplants a year, and we have the largest pancreas transplant program in the entire nation. So we're really honored to be able to take care of the community.
That must be very impactful for you as well, to truly save lives there. When we're talking about risk factors, doctor, what do people need to know or need to watch for? We were hearing from Durrell there, you know, suddenly he was thirsty. This was a very unusual, a very clear, out of the ordinary situation. Is that how diabetes usually presents? What are some other risk factors, things to watch for?
Yeah, well, first, the degree of the problem is unbelievable. There are about 39 million Americans, so that's over 1 in 10 Americans with diabetes right now. And there are countless people who will develop diabetes over the course of their lives. In fact, we're still seeing an increase in both type 1 and type 2 diabetics in America's youth. So this is a growing problem. And then what Durrell experienced is not completely atypical. You have to be careful when you start experiencing blurry vision, increasing thirst, going to the bathroom more frequently. Those are some signs that your blood sugars are out of control and you need help. Very important to watch for. Obviously, a scary situation there. I just hosted over the weekend the Mid-Atlantic Hope Gala raising funds for diabetes research. I was hearing so many stories there. Some people, you know, they're diagnosed with no family history, nothing. It's almost out of the blue. What are some risk factors? You know, if someone in your family has this, should you look to preventative care? What do you recommend, doctor? Well, we should all be on the lookout, both for our loved ones and friends and for ourselves. If people can stay fit, eat right, and go see their primary care doctors on a regular basis, a lot of the end organ damage from longstanding diabetes can potentially be avoided.
And if someone is diagnosed with diabetes, so many unknowns, people feel like their world has changed in an instant. Doctor, what is your message to them? What do you want them to know to keep the hope?
Well, their world has changed in an instant, but there are lots of good ways to manage diabetes, and they should seek out care at a place like MedStar Georgetown, where we have a really massive army of primary care physicians and endocrinologists all ready to help prevent those ravages of diabetes. And if things progress to where they have kidney disease and they need transplant, they're in exactly the right place out of anywhere in the country. This is where I would come if I needed a kidney transplant. So the whole spectrum of care is available to them.
A great army who is helpful and nice and taking care of you. Dr. Stephen Potter, thank you so much for joining us, kidney pancreas transplant surgeon at MedStar Georgetown. We appreciate all of your great information here on 7 News at noon.
Thank you, Megan.